All right, so ready to talk about other structures of the male reproductive system. Finished up last week by talking about the testes and the wonderful tube-like structures inside where the sperm are produced, and then those are transferred to the epididymis where the sperm are stored and then they mature. Talked a little bit about the vas deferens, ductus deferens that carries the sperm out of the testes back into your abdomen through that inguinal canal. Now we get to talk about quite a bit of other stuff. All right, we're going to start by talking about the scrotum. Scrotum is a supporting structure for the testes. It is essentially a sac that encloses them. It consists of hair and superficial fascia hanging from the base of the penis. Externally, it looks just like a single pouch of skin, separated into lateral portions by a median ridge called the raphe. If I just jump ahead to the next page, this little kind of ridge between the two sides is got a special name called the raphe. Whereas if you look internally, there's an actual wall that divides the scrotum into its two compartments. That wall is called the scrotal septum, and you can see that also here in that same image. And so it creates these two different rooms where the two different testes are located. The function of the scrotum is to place the testes in an environment that's about 2 to 3 degrees Celsius below our core body temperature. And this is important because it enables the testes to be a little bit cooler for proper storage of sperm, because essentially if the sperm are heated up too much, they die. They don't develop correctly, and therefore they would not be able to fertilize an egg. So there is a pair of muscles that aid in keeping this maintained lower temperature. They include a dartos muscle that contracts to cause wrinkles in the scrotum, the scrotal skin, causing it to thicken and reduce its heat loss when it's cold. So essentially, it's going to contract and make the scrotum thicker, like basically just creating like a thicker coat, putting on a bigger, heavier jacket. Okay. Whereas the cremaster muscle, this is actually a muscle located within that spermatic cord that we talked about the other day. And when it contracts, it can pull the entire scrotum up or down. In the case of if it contracts, it pulls it up closer to the body, so it pulls it up, which is going to help keep the testes closer and keep them warmer. Whereas when if it's hot, it relaxes and the testes hang lower because the scrotum falls farther from the body. I'll show you right here. We can see on the right side, the left part of the image, but the right testes and the left side here is that cremaster muscle, and you can see it's going to pull upwards, and then down here, just beneath the skin of the scrotum, is that dartos muscle that can change the thickness of that skin. So we can't see those here in this image, which is why I jumped ahead to the next page. So that's what your scrotum does. Okay, let's talk about some glands and whatnot, starting with the seminal vesicles, which are a pair of glands posterior to the base of the urinary bladder, secreting an alkaline fluid to neutralize the acids of the vagina, fructose, which gives energy to the sperm, and prostaglandins that contribute to sperm motility and viability. Motility just means that it helps them swim. Viability means that it helps them live, keeps them from dying. There's also going to be clotting proteins that cause coagulation, which is a fancy word for clotting after ejaculation. And when they release their secretions, they're going to be passed through seminal vesicle ducts. Now, here is that same image that we looked at the other day at the end of our urinary lecture, with quite a bit more labeled. Here, right there, and here's your bladder just back behind it. is where you find the seminal vesicles. Now, this is showing you a sagittal plane, so we're only seeing half, so we can only see one of those seminal vesicles. If I zoom in a little bit, it's not labeled, so right here, connected to that seminal vesicle, I want you to draw in an arrow and point to right here where I'm showing you with the cursor, and label that as a seminal vesicle duct. So right there is the seminal vesicle duct. If I go to the next page, looking here at this image where we can see both of those seminal vesicles, the ducts are actually labeled. There's one labeled right there, and then there'd be another one right there attached to this seminal vesicle, but those join together with the ductus or vas deferens that we talked about the other day. Remember, there's a fancy name for the end of that vas deferens. It's called the ampulla of it, ampulla of ductus deferens. The seminal vesicle duct and that ampulla unite, and that forms what's called the ejaculatory duct. Okay, and there are two of them since there's two seminal vesicles. They're both very short, about 2 centimeters or an inch in length. Once again, formed from the union of the ducts from the seminal vesicles into the vas deferens. Each passes through the prostate gland, emptying into the prostatic urethra. And they don't secrete anything. They're just a tube. So their job is just to force sperm and seminal fluid into the urethra during ejaculation. So here's the seminal vesicle duct. Here's the ampulla of the ductus deferens. They come together. There's your ejaculatory duct. Remember, this is the prostatic urethra. And you can see where that ejaculatory duct ends is that prostatic urethra. Now, speaking of the prostate, let's talk about that. This is a single gland. So notice it's not pluralized. It's a singular structure, has a donut shape to it, and it surrounds the prostatic urethra and ejaculatory ducts located immediately inferior to the urinary bladder. And it's going to secrete a milky, slightly acidic fluid into the urethra, increasing sperm motility and viability. So kind of doing some of what the seminal vesicles do. But this is where that kind of milky white appearance to semen comes from. Inferior to the bladder, or excuse me, inferior to the bladder, but inferior to the prostate is a pair of very small glands, what we call the bobourethral or Cowper's glands. Okay, we only see one of them there. Position at the inner end of the penis, just below the prostate, where they function to produce a clear alkaline fluid that will lubricate the head of the penis and protect the sperm by neutralizing the acidity of residual urine. They also secrete mucus, which helps lubricate the end of the penis, which helps decrease the number of sperm that are damaged when a male ejaculates. This is where that pre-ejaculate fluid comes from, not the powerful release of the ejaculate, but the kind of trickle out fluid that comes out of the penis before the powerful ejaculation process. And then the urethra, we've already talked about that quite a bit. Back in our previous lecture, we learned that it's in males anyway, a shared tube of the reproductive and urinary systems, carrying urine from the bladder during urination as well as semen during ejaculation. 3 parts include the prostatic urethra, the intermediate or membranous urethra, and then the longest part is the spongy urethra. And that spongy urethra is found within the penis, a cylindrical organ that passes urine and serves to deposit semen into the vagina. And as you can see, there's quite a bit of complexity to the penis, and we'll get into that more on this next page that I've kind of bounced back and forth with. I can pretty much tell you, since you've seen this picture twice now, it's an important one. Okay, and I think it's just going to be easier if I tell you what not to worry about. So here's stuff that I don't care about you knowing. On the left side, the sacrum, the vesicorectal pouch, the coccyx, the rectum, and then the anus. Those are all stuff from a different unit, obviously. You need to know everything on the bottom, so I'm not going to mention anything there. On top, right here, I don't care about you knowing the peritoneum. Don't worry about the pubic symphysis. That's that cartilage that we've talked about before. Don't worry about deep muscles of the perineum. But everything else will be fair game. Now, a couple things. Once again, if you didn't already do it, maybe do it now. The seminal vesicle duct right there. Intermediate urethra might not be a bad idea to put in parentheses. That's also known as the membranous urethra. It has that double name. And then this tube, I don't know why it's not labeled, is a ureter. So make sure you probably want to label that as well. All right, now we can talk more about the penis and all those different things that are labeled there that I didn't really mention yet. Once again, the penis contains urethra and is a passageway for ejaculation of semen and excretion of urine. Has a cylindrical shape to it and consists of kind of three major regions. The body or shaft, which makes up the bulk of the penis. The root, which is what attaches it to the perineum. The perineum is the floor of your pelvic cavity. And then the glans penis, which is what a lot of people just commonly call the head, is the enlarged end. So that will be at the distal side of the penis. Okay. Let's talk more about the body or shaft, made up of three cylindrical masses of tissue. And you can see them very nicely here in this image where essentially the penis has been cut away. So this is exactly what's been done down here. This is just from a cadaver. To me, this always looks like a bug. But you can see the big three chambers where there's two of these, what we call corpora cavernosa, and one, which is what surrounds the spongy urethra, which is the corpus spongiosum. Now, this word corpora and this word corpus, those are the same word. This is just the pluralized version of it. Okay, so that's why if you look back on the previous page, it says corpus cavernosum, whereas down here it's corpora. Same thing if you just remove the A and add um, like in this case, corpus cavernosum, that makes it singularized. Does that make sense? Okay, so those are two masses of tissue that fill most of the volume of the penis. At the center of them, you can see there's a deep penile artery. This is a very important blood vessel that brings blood into the penis. And when that happens, the penis gets enlarged. That's what causes an erection. That blood kind of gets trapped because the blood vessels that drain the blood out, they kind of get pinched shut. That's not hopefully forever, but they get kind of closed, so the blood kind of gets stuck in the penis, and that's what causes it to enlarge. Okay. Surrounding the spongy urethra is the corpus spongiosum. So hopefully it's pretty easy to remember. The spongy urethra gets its probably a name because it's surrounded by the spongiosum. Okay. The root is what attaches once again the penis to the perineum and consists of a bulb and crura. And the bulb is the expanded portion of the base of the spongiosum. And we can see that very nicely here in our picture, which is a frontal section where essentially the top of the penis has been removed. Whereas here, just right below that, labeled is what we call the crus of the penis. And it's the same situation. Crura is plural, crus is singular. So since one is labeled, that's why it's written this way. But the crura are the two separated and tapered portions of the cavernosa. And as you can see, they separate from one another, and then they come to a kind of a point, so they taper. But those are the ends of the cavernosa. And then at the distal end of the penis is the glans, which is a very sensitive area, a lot of receptors in there for the sensation of touch. It is quite a bit wider than the body of the penis, and there's a little margin right there where it kind of tapers outward, has a special name known as a corona. And if you are dealing with an uncircumcised male, like in this case, it will be covered with foreskin, as we commonly call it, which has a special name known as the prepuce. Okay. Now, holding the penis and supporting its weight are two ligaments continuous with the fascia of the penis, and they include a fundiform ligament, which you can see has this kind of two arrow pointing to it. It rises from the inferior part of the linea alba. Remember, the linea alba is a little vertical line that runs down between our ab muscles. And then the suspensory ligament right down the middle there in this illustration arises from the pubic symphysis, which if we go back to the previous page, this structure here that I told you didn't need to worry about is the pubic symphysis. That's that little piece of cartilage between the two hip bones, but that's what the suspensory ligament is going to help attach to. And we don't see the fundiform ligament in this picture, but that's okay. Now, these images here on the next page are also images that I want you to know for the exam. You may or may not see them. You're probably definitely going to see the one on the previous page. But as far as this image, once again, kind of be easier probably if I tell you what not to worry about. Don't worry about the deep muscles of the perineum. And I would say everything else would be fair game. I guess you don't need to worry about orifice of ejaculatory ducts. On the anterior view, this figure, here's what you do need to know. It's not quite as intense. You do need to know the fundiform ligament, the suspensory ligament, corpora cavernosa, spongy urethra, corpus spongiosum, the scrotal septum, cremaster muscle, dartos muscle, and just scrotum is fine, not skin of. On the right side of the image, the spermatic cord. Skip down to the ductus or vas deferens. And then the epididymis. And then the raphe that we talked about. Here in this bottom left image, basically everything that's capitalized, I would say. So you don't need to worry about hip bone, deep muscles of the perineum. I guess you don't need to worry about the ureter or the bladder since this is reproductive stuff, but they are visible. And then you don't need to worry about this image. All right, last little bit here on guys. I want to talk a little bit about sperm and semen. All right, each day about 300 million sperm complete the process of spermatogenesis. Remember spermatogenesis? Hang on, somebody's here.
Key real quick to their office carrying something.
Yes. Okay, so once again, about 300 million sperm each day go through that process of spermatogenesis, production of sperm, okay? 300 million sperm every day from a guy's time when they go through puberty until they die. Now that number might go a little bit down as they get older, but in theory, it is possible for a man to be 110 years old, barely living, and still produce viable sperm that could impregnate a female, okay? Obviously, guys are not making 300 million babies a day, which tells you that sperm are produced in way excess of what they actually utilize, and some guys never even make babies in their life. So producing a lot of sperm that effectively don't end up doing anything, okay? Structurally, sperm are about 60 microns in length, containing several structures adapted for reaching and then penetrating an egg cell. And there are two principal parts, a head and a tail. The head is very important, and that's because it's got the nucleus, and this is where you're going to find the 23 highly condensed chromosomes, which is half the number of what you'd find in a normal typical cell. In other words, not a sex cell like a sperm. Okay. Eggs also have 23 chromosomes, and that's important because when the nucleus of a sperm and a nucleus of an egg unite, that enables those 23 chromosomes to add together, and that's what gives you 46 chromosomes, and that's how we all begin our life in that single cell called a zygote. Okay. Now, covering the anterior 2/3 of that head is a cap-like vesicle called acrosome, and inside of that vesicle are enzymes that help it to penetrate the egg, and it basically helps it burrow in. It releases these digestive enzymes that break through the outer layer of the egg and enable it to get inside. Okay. Then you've got the tail, which just helps move the sperm during locomotion, so it enables it to swim. It's got a little constricted part here at the beginning called the neck. Distal to that is the middle piece, where you're going to find a lot of mitochondria to give it energy. The longest part is the principal piece, and then a little whip-like tail at the end is its end piece. I do actually want you to be able to identify those parts, so make sure you know the structure of a sperm. Okay. Keep in mind, sperm is not the only thing that's released when a man ejaculates, and that's because they're releasing semen, a mixture of sperm and seminal fluid. Typical volume is around 2.5 to 5 mils, and each of those mils is going to have about 50 to 150 million sperm. So a whole bunch of sperm. Okay, has a slight alkaline pH of 7.2 to 7.7 because of the secretions from the seminal vesicles. What semen does is provides a transport medium, nutrients, and protection for the sperm, and will coagulate or clot after ejaculation because of those clotting proteins that we mentioned. A couple pictures here. These are from cadavers. As you guys know, I like to put those in whenever possible. This is essentially just showing you the exact same thing as what you see here. So it's a sagittal section, which gives you a cool view. You can see the parts of the penis. You can see a testis. You can see the bladder real nice. You can see the prostate with the prostatic urethra passing through it. There's one of those seminal vesicles. Some of the stuff's kind of harder to tell, like they don't have the bulbourethral glands labeled, just probably because they're too small, but you can see the urethra really nicely, which is really cool, but not something I'm going to worry about you knowing for the exam. This image is pretty much the exact same thing as what you saw here on the bottom left of the previous page, a posterior view, where you can see definitely the bladder. Here you can see both of the seminal vesicles. There's the prostate. Here's the vas deferens, and you can see how it widens out, becoming in the ampulla. So it's pretty cool, but not something you need to worry about for the exam. And with that, we can move on and talk about the female reproductive system. Just like we started with the primary sex organs in men, which were the testes, we're going to do that here with the females, and that is with the ovaries. Ovaries are a pair of glands that are the site of gamete production in females. The process there is called oogenesis. So we had spermatogenesis in males, oogenesis in females. Okay, and this is where the eggs or ova are produced, but also the main endocrine glands of the female system secreting female sex steroids, estrogen, and progesterone. Okay. Holding the ovaries in place are a series of ligaments, including a broad ligament, a fold of parietal peritoneum attaching the ovaries by a double layered fold of peritoneum called the mesovarium. The ovarian ligament anchors the ovaries to the uterus, and the suspensory ligament attaches the ovaries to the pelvic wall. We can see some of those here in this image, which is that same image that we saw the other day at the end of our urinary lecture, although now we've got quite a bit more labeled. We can see some of those also in this image. This actually gives you a kind of a better view of some of those. Like there's the mesovarium, there's the ovarian ligament. This is looking down into the kind of pelvic cavities from above after a transverse section has been performed. We can see in white very nicely are the two ovaries. Okay. Now, this image is going to give you kind of an internal view of the ovaries, as well as give you a view of the tissue that surrounds it. Okay, but there's actually two tissues that surround it, a germinal epithelium, which is an outer layer, and that's simple epithelium. And then the tunica albuginea is a fibrous layer inside of that. Okay, what we can see here is just the germinal epithelium. They don't label the tunica albuginea, but that's okay. Okay, deep to the germinal epithelium in our picture is where you find the two kind of functioning regions of the ovaries, the medulla and the cortex. And we've seen these words several times this semester, so that should not be any surprise that the cortex is on the outside, just deep to the albuginea, whereas the medulla is deeper in the middle. And there's a lot less going on with the medulla. This is where you find loosely arranged connective tissue with blood vessels, lymphatic vessels, and nerves, and not much else. Whereas in the cortex, this is where you're going to find what we call the ovarian follicles, which are these, if I zoom in, structures that are labeled. There's several different forms of them, but these are essentially bubbles that are developing the egg inside. Okay, it begins with what's called a primordial follicle, and that develops into a primary and then a secondary, eventually into a mature follicle. This is the egg. This is a fluid inside called follicular fluid. And each month during the female's reproductive years, because there's only a set time when females are going to be doing this, from puberty until menopause, a female will be ovulating. And this is about day 14 on her 28-day cycle, which is where this big bubble bursts, and the egg, the oocyte, which is what its fancy name is released out into these fallopian tubes. And we'll talk about the fallopian tubes on the next page. As far as identifying the different follicles and whatnot, you don't really need to do that. In fact, this image, there's only three things I want you to highlight, and that's the germinal epithelium, the cortex, and the medulla. So nothing too crazy there. Now, this image, I do want you to highlight quite a bit. You know what, probably it's going to be easier if I just tell you what not to worry about. So don't worry about the sacrum. Don't worry about the coccyx or the rectum or the anus. And then on the right side, you need to know everything with the exception of the pubic symphysis. I'm not gonna worry about this image. A reason why, it's just kind of harder to tell things apart, but it does give you a good view of some of those ligaments in it. One thing I do like is it shows you the relationship where the uterus is with regards to the bladder and with regards to the rectum, especially the bladder. And you can see why, if you've ever, sometimes I have students that have had babies before, and they can attest to this, why they, during pregnancy, have to pee all the time, because the uterus is where the baby develops, and that's just going to be pushing a lot on that bladder and give that urge to go. This image here is the cadaver version of this picture. So a sagittal section where you can see very nicely the uterus. Just below that is the bladder. We can see the vagina and the urethra, two completely separate structures. And we'll get into those, or some of those anyway, here on this next page. All right, the uterine tubes, also go by the term fallopian tubes or oviducts, are the active conduits for the ovum to reach the uterus. So essentially, this is where a egg will be ovulated out, and eventually, if possible, fertilized by a sperm. Okay, and this is hopefully not the place where that egg transforms into a baby after being fertilized by a sperm. Okay, that's where the uterus comes into play. Okay, now there are times where sperm and egg unite, and then that developing cluster of cells called a blastocyst implants in the wall of the uterine tubes. Anybody know what that's called? tubal pregnancy or an ectopic pregnancy, and that's not a viable pregnancy, and a lot of times leads to like miscarriage, unfortunately. As far as the uterine tubes go, there are 3 different regions. The infundibulum is the first, the ampulla is the middle, and it's the widest and longest, and the isthmus is what leads to the uterus. Okay, let's talk a little bit more about the infundibulum. In this region are pulsating cilia that help draw the secondary oocyte into the uterine tube after being expelled from the ovary. Associated with the infundibulum are these little finger-like extensions that kind of wrap around the ovary, and they have a special name called fimbriae, I believe is how you pronounce that, but those are specifically associated with the infundibulum. Now, the ampulla is a very important region because not only is it the widest and the longest, it is also, and I would highlight this, the typical site of fertilization by sperm. So that's where the sperm have swam to and find the egg and start burrowing in. Okay, isthmus just narrows and leads to the uterus. The wall of each uterine tube is 3 layers thick, with a serosa, serous membrane on the outside, a middle muscularis made up of 2 smooth muscle layers that help move the oocyte forward, and then the inner mucosa where you find kind of 2 major types of cells, ciliated columnar epithelial cells that help move the oocyte forward, and secretory or PEG cells that lubricate the tube and nourish the oocyte. Okay. The uterus, which I put in parentheses, is the womb, a thick muscular chamber that functions to harbor the fetus, provide a source of nutrition, and expel the fetus at the end of its development. And that's just word for word what you see in your textbook. It makes it sound really technical and not a beautiful thing. And this is where a baby develops and grows. Mom nourishes it and then gives birth, which sounds a lot better than harbor the fetus, provide a source of nutrition, and expel the fetus at the end of its development. Okay. There's 3 regions to the uterus: a dome-shaped superior region known as the fundus, a tapering central body, and then an inferior structure or region called the cervix. So at the top here is the fundus, the body is in the middle, and then the narrow region at the bottom is the cervix, which you've probably heard of before. This is what must dilate in order to allow the baby out, okay, during childbirth. They say that this opening here that leads from the cervix to the vagina goes from about the same width as a pencil, not like the length of a pencil, but the width of a pencil, to the size of the baby's head. Okay, so that obviously must expand tremendously, and if you are planning on having children in the near future, hopefully I didn't scare you off from it. And there are 3 layers to the uterine wall, and each has a special name, all of them in the same way though, with the metrium at the end of it. Perimetrium is the outside of serous membrane. It is part of the peritoneum, and therefore is where it gets its name, perimetrium. Once again, the peritoneum, is that double layered membrane we talked about previously back in our digestive lecture. Anteriorly, it reflects off the uterus to cover the urinary bladder and forms a shallow pouch, which is called the vesico-uterine pouch. And then posteriorly, it covers the rectum and forms a deep pouch between the uterus and rectum, what's called the recto-uterine pouch, which is the most inferior part of the pelvic cavity. And those are actually labeled here on the previous page. Here, right there is the vesico-uterine pouch, and then right here is the recto-uterine pouch. The middle part of the uterus is the thickest layer, and this is called the myometrium, and it's known as the myometrium because myo means muscle, and that's what's found here, which is smooth muscle that helps with childbirth. And you can see very nicely how much thicker it is than the other 3 layers. And then the innermost layer is known as the endometrium. The endometrium is a highly vascular mucosa consisting actually of 3 sublayers: a compact layer, a functional layer, and a basal layer. And both the compact and the functional layers are actually shed when a female menstruates, and that's where that bleeding comes from. And then that's what takes place for like 5 days at the beginning of the menstrual cycle. And then after that, the female develops those back, and that's through cell division from the basal layer. Let's talk a little bit more about the cervix, the narrow region at the bottom of the uterus leading to the vagina. Cervical mucus secreted by the cervix helps protect against bacteria that may enter the uterus from the vagina. So that helps keep the uterus nice and clean. Cervical canal opens into the uterine cavity at the internal os and to the vagina at the external os. So here's the internal os that leads back up to the rest of the uterus. The external os leads down to the vagina. Okay. Several ligaments that are either extensions of the parietal peritoneum or fibromuscular cords help maintain the position of the uterus, including a pair of broad ligaments. We can see them very nicely here. There's also uterosacral ligaments, cardinal ligaments, and round ligaments. We can see the uterosacral ligament just barely right there. And if we were to go back to this picture, we can see some of those, but I'm not going to worry about that picture, like I said. All right. Final structure to discuss here on this page is the vagina, which can also be described as a birth canal, tube allowing for discharge of menstrual fluid, receipt of the penis and semen, and birth of a baby. Okay. Once again, pretty technical description of what's taking place here. Associated with the vagina are specialized folds called rugae or vaginal rugae, which enable it to expand. And those are just like the rugae that we've talked about here previously, found in our stomach and bladder for expansion purposes. The wall of the vagina is 3 layers thick, an adventitia on the outside holding it in position, middle muscularis made up of 2 layers of smooth muscle, permitting expansion during childbirth and sexual intercourse, and then an inner mucosa where the bacterial action on glycogen stored, that's stored in their mucosa cells, produces an acidic solution that lubricates and protects the vagina against other microbial infections. There's a special recess called the fornix, and you can see that's labeled here, lateral fornix, surrounds the vaginal attachment to the cervix. This is where a contraceptive device known as a diaphragm would rest, which is going to prevent the sperm from swimming up and eventually up into that fallopian tube to fertilize the egg. Okay, this is a very important image where you can see quite a bit of stuff, and pretty much I would say everything would be fair game. So make sure you know it for next week. Now, so far we've covered the female reproductive structures internally, but there's quite a bit to talk about externally as well. And we'll do that here on this next page. Now, we're going to do some coloring. This will be our very last coloring of the semester to identify these structures. And I like these 2 pictures. This is kind of a surface view. What we're looking at is, as you can see here, the female perineum. So with the female's kind of legs spread, kind of sitting on a table. This is a dissected view. We can see some of the internal features. I like that picture, these 2 pictures quite a bit better. This is kind of what your textbook has, where you can see some of those things. But it's a lot easier when you color code everything out. And so we'll do that as we go through and talk. Let me see. What we're looking at on this page goes by what we call the vulva or pudendum, or what most people just call the external genitalia of a female. And that includes quite a bit. Okay. The mons pubis is not something that we need to color because it's actually labeled right here in this picture. It's a region of adipose or fat tissue above the vagina covered with hair that functions to cushion the pubic bone and to aid in its lubrication. I tell you what, let's just color code, and then as I color, I'll explain the different structures. So coloring things out here, the labia majora, I'm going to color this kind of dark green. The menorah, I'm going to color this baby blue. The frenulum, color maroon. The vestibule, I'm going to color yellow. The external urethral orifice, I'm going to color that black. Vaginal orifice, I will color orange. Hymen that surrounds that, I'm going to color pink. Prepuce, I'm going to color tan around the labia or the clitoris here. Then for the clitoris itself, I'll go light green for the glands. This gray color for the body. Dark blue for the crus. And then peach for the vestibular bulbs. About purple for the Bartholin's or greater vestibular glands. All right. So we already talked about the mons pubis. Let's talk now about the labia majora. Now the term labia and majora, both of those terms are pluralized. If I go back to this picture, you can see labium majus, that's one, since this is a sagittal section. A labium is singular version of labia, majus is singular version of majora. Okay. But those are a pair of thick folds of skin and adipose tissue bordering each side of the vagina, where you'll find hairs, sebaceous glands, and pseudoriferous glands. And they are the big letter E here in our surface superficial view. Medial to those are the labia minora. Same thing, labia plural, minora singular or plural. Okay, whereas in that picture it'd be labia minus. Okay, but they secrete an oily substance. There's hair. Hair would be absent, excuse me, and are analogous to the spongy or penile urethra in males. Okay. They're letter F here in our two images. We can see them in both pictures. Although here on the left side of the image, it's kind of been cut partially anyway. Where those unite, they're at the top. That's a special structure known as the frenulum. And then the area between those, come on, focus in, is the opening or the space known as the vestibule. Okay, and that's this big area, letter N, which is where you're going to find the openings from the vagina and the urethra. The opening from the urethra is letter O, and that's the much smaller orifice, which makes sense. This is where the P comes out. Doesn't need to be very big. Whereas the vaginal orifice, this is where the baby would come out and the penis would go in during sex. so. And then surrounding that here in our superficial views, letter P, which is the hymen, a fold of vascularized mucous membrane, and typically is lost after a female loses her virginity. All right, the next structures we'll talk about are all associated with the clitoris. Structured like the penis, except there's no urinary role. So it's entirely sensory and is the primary center for erotic stimulation in females. At the top here of our superficial view is where you can see part of it, plus what's called the prepuce. The prepuce is something that we actually learned is a fancy name for the male foreskin, is essentially very similar to that here. It is kind of this triangular shaped region right here, formed at the point where the labia majora unite and covers the body of the clitoris. Okay, what we can see here in our surface view, our last structure to show is the glans clitoris. Okay, the glans clitoris is similar to the glans penis. It's the end, and a ball-like structure, very sensitive, a lot of tactile receptors in there. Okay, that is our last structure over here in the superficial view, which therefore we'll move over to our dissected view. And the next part of the clitoris, letter J, is the body, which passes internally inferior to the pubic symphysis, where it then forks. And those forks include the crus clitoris, letter K, here on the left and right sides. Letter K here on the left side is very visible. Over here where we're not quite as dissected, we can't see all of it, but we can see it kind of pointing out down here at the bottom. Okay. Like the penis, they undergo vasocongestion, which means they can engorge with blood, and that helps with like tightening the vagina during sexual intercourse. So it's kind of like a female erection. Same thing happens to the vestibular bulbs, which are these big structures, letter L. And we can see them on both sides kind of in different ways. But they are going to go through vasocongestion, which causes the vagina to tighten when stimulated, which is going to make them analogous to the spongiosum in the bulb of the penis in males. Okay, last structure that I can color is this letter M, hanging down at the bottom, where we've removed part of the vestibular bulbs. These are called the greater vestibular or Bartholin's glands, which have ducts that open into the lower vagina and function to secrete mucus, which lubricates the vestibule during intercourse. So this is natural lubrication, and they're analogous to the bulbourethral Cowper's glands in males. There's also several lesser vestibular glands that also open to the vestibule that you can't color or identify, and that's okay. Last structures are the paraurethral or Skene's glands, which are named because they are associated with the urethra. And really they aren't visible, and the only reason I included them is because they are actually analogous to the prostate that a male would have. Any questions here? All right, well then we'll move to our very last slide. Here at the top, we'll talk about the perineum, and then down at the bottom, we'll talk about the breast tissue and the structure associated with that. Perineum is something that we've mentioned before back in our skeletal muscle lecture. When we identified the muscles of the body, we learned that the perineum is a diamond-shaped area medial to the thighs and buttocks of both males and females. So it's not just females, although that's what's shown here. Males also have a perineum. Essentially is that area, between the genitalia and the anus, which is what is contained within the perineum. Anteriorly, it is bounded by the pubic symphysis, that piece of cartilage. Posteriorly, it's bounded by your coccyx, your tailbone, And then laterally are the two ischial tuberosities, the little bumps on your hip bones that we sit up on when we sit, or when we sit on when we're sitting upright. Okay, so that's what creates this diamond-shaped area. And if you take a line and draw it across horizontally, you create two separate triangles, what are called the urogenital and the anal triangles. The anal triangle obviously has the anus. The urogenital triangle has the urinary and genitalia structures. As far as what you need to know, just highlight urogenital triangle, anal triangle. I'm not going to worry about any of those things that we just identified on the previous page because we got them colored out. I think that makes it a lot easier to see. So we'll move on to our last structure to discuss, the breasts, which is not the first time we've mentioned and talked a little bit about breasts before. Back when we kind of introduced glands in the very first unit, we talked about mammary glands. But a breast can be described as a hemispheric projection of variable size on the chest. Each breast is located anterior to the pec major and serratus anterior muscles and is attached to them by a thin layer of fascia composed of dense irregular connective tissue. Each breast has one nipple, and if you are a female, would be also loaded with a mammary gland. Okay, strands of connective tissue called the suspensory ligament of the breast or Cooper's ligaments run between the skin and the fascia and support the weight of the breast. And we can see that very nicely right here in our sagittal section picture. This is what can wear out, especially in big breasted females if they don't do a good job of supporting, wearing a bra. And that's why as females get older, things don't tend to stay upright like they used to. And that's because of this suspensory ligament. The mammary glands, let's talk about those, are modified sudoriferous or sweat glands specialized for the production of milk. A singular mammary gland consists of 15 to 20 lobes, so little segments separated by a variable amount of adipose or fat tissue, which is what really determines how big the breast would be. Each lobe is composed of several smaller lobules, which are composed of small grape-like alveoli. Because why not name something else alveoli? We learned previously that alveoli are the sockets where our teeth are. We learned alveoli are the little ball-like structures in our lungs where we perform gas exchange. Now we see alveoli are where the milk are produced in the female breast. Okay. Now from there, the milk is going to be ejected out thanks to myoepithelial cells that surround the alveoli. And from there, it's all going to be channeled towards the nipple because of a pretty complicated but pretty amazing duct networking system. Okay, from the alveoli, the milk will pass into a series of secondary tubules and then into mammary ducts, which then expand like slightly to form lactiferous sinuses, which are close to the nipple, and then the lactiferous ducts are what actually open up to the nipple, which is different than, for example, like regular normal sweat glands, which the gland has just kind of one singular tube that connects to the surface of the skin. Well, in this case, we're all going towards the same place, which makes it good for the baby. They can put their mouth around the nipple and all the milk's going in that spot and not in all sorts of different places. Okay. Speaking of the nipple, it has those openings of the lactiferous ducts. Each nipple will have about 6 to 8 of those terminal duct openings. Presence of sebaceous glands will make the texture of the nipple feel a little bit coarse or rough. And then surrounding it of variable size, the areola, pigmented area, which also appears rough, but due to modified sebaceous or oil glands. Okay, I do want you to highlight a couple things down here in these two images. Highlight the suspensory ligament. Highlight, just highlight alveoli. Don't worry about lobule containing, just alveoli. And then let's highlight the lactiferous duct, the nipple and the areola here, and the nipple areola over here. I won't worry about the smaller ducts and sinuses and whatnot. So just the ones that open up at the surface of the nipple. Okay, any questions?